When you see a child with behavioral issues, always think about the core symptoms of ADHD. These are inattention, hyperactivity, and impulsivity. ADHD is a common neurodevelopmental disorder that affects a child's ability to function in daily life. It's important to check if these symptoms are present in multiple settings, such as school, home, or during clinical interactions, as this helps to confirm the diagnosis. Remember, early identification and intervention can make a huge difference in the child's long term outcome. Assalamu alaikum. Today I'm going to read AKP clinical case number 8, that is a disruptive boy. A 7-year-old boy who is struggling with behavioral and academic challenges. Let's analyze his symptoms and arrive at a clear diagnosis. Here is his history. Let me start with the child's behavior at school. In the classroom, this child has a very short attention span, which means he struggles to stay focused on tasks. As a result, he is falling behind in his schoolwork. The teachers also find him excitable and disruptive. He often distracts other students, making it harder for them to work and for the teachers to manage the class. At home, his parents describe him as being always on the go. He is constantly restless, moving around, and full of energy. This is a clear sign of hyperactivity. They also report that he behaves impulsively and finds it hard to stay calm or regulate himself, which shows that his symptoms are not limited to school, they are present at home as well. When it comes to social interactions, this child does not have close friends and often prefers to play alone. This could be because his impulsivity and lack of self control make it hard for him to connect with other children and maintain friendship. In the clinic, we observed similar behavior during the examination. He was unable to sit still, showing hyperactivity once again in a different setting. Finally, looking at his background, the child comes from a stable family environment. There is no history of trauma, abuse, or major socioeconomic challenges. There are also no developmental delays, and his physical examination was completely normal. These behaviors present across school, home, and clinical setting clearly points towards ADHD as the most likely diagnosis. So that is the answer of first question which is asked in this case. We also need to think about other conditions that could explain this behavior but they don't fit as well. Kids with autism may prefer being alone, but they usually have repetitive behaviors or a strong need for routines which this boy does not show. Next option, bipolar disorder needs both high energy phase, that is mania, and low energy phase, that is depression. This boy does not have any depressive episodes. Next is OCD. OCD involves repetitive obsessive thoughts or rituals, and his behavior is not like that. Next option is post-traumatic stress disorder, usually happens after a trauma or abuse, but this child has no history of such events. So the best explanation for his symptoms is ADHD because he clearly shows inattention, hyperactivity, and impulsivity in different settings. Second question is, if a drug such as methylphenidate were to be used in his treatment, which of the following is the most important side effect? Methylphenidate is a drug used in ADHD treatment. Let's talk about its side effects. The most important side effect is decreased appetite and weight loss. Methylphenidate is a stimulant that works by increasing dopamine levels in the brain, which helps with focus and reduce hyperactivity. But like many stimulants, it can suppress appetite, leading to weight loss and, in some cases, slower growth in children. This is why we need to monitor a child's height and weight every 6 months during treatment to ensure they are growing properly. Now let's quickly go through the other options and why they don't fit. Number 1 is constipation. This can happen but is not very common or significant. Next option is excessive somnolence. Methylphenidate actually causes insomnia at night, not daytime sleepiness. Next, hypertension. Stimulants tend to increase blood pressure and heart rate, so they cause hypertension, not to low blood pressure. Next, seizures. While very rare, seizures are not the main concern with this drug. So the correct answer is B, decreased appetite and weight loss, and that the side effect we need to watch for most closely. In summary, this child case strongly suggests ADHD due to the presence of inattention, hyperactivity, and impulsivity across different settings. When treating with ADHD with medication like methylphenidate, the most important side effect to monitor is appetite suppression and weight loss, which require regular follow-ups to ensure the child is growing properly. If you have any question about this case, comment below. Thank you so much. Like, subscribe, and share.